Singapore has approved the use of remdesivir to treat severely ill COVID-19 patients. It's one of the first few countries in the world to do so, following South Korea, Japan, India, and the US. The go-ahead follows an expedited review by the Health Sciences Authority, given the urgent public health need during the pandemic. Gillette Sciences says the approval is conditional on submission of data from ongoing clinical studies. That will ensure the antiviral drug's continued safety and efficacy. HSA says the drug is for adult patients with low oxygen levels or who need breathing support. Access to the drug in Singapore was previously limited to patients enrolled in clinical trials. Singapore will also begin its first human clinical trials next week for a potential antibody treatment. The first phase of the trial will be conducted on 23 healthy volunteers aged between 21 and 55. It will last about 6 weeks, during which they will be given TY027, a therapy developed by Singapore-based biotech firm Tycan in partnership with several government agencies. Pending phase 1 results, the next phase will see the treatment administered intravenously to COVID-19 patients. Tycan says the antibody could potentially be used to prevent infection as well. The firm says clinical trials usually take 2 to 3 years, but a rapid response rate and its research has helped it shorten the timeline to just 4 months.
We're excited about what's going to happen in the next few weeks as we get into human trials, but at the same time, we also must be aware that a lot of drugs fail at the clinical trial stage and don't get licensed. So there's still a lot of work for us to do. We hope that this treatment that we have will reduce the number of people who will go into such a severe disease, and hopefully the number of people who will die from COVID-19 will become minimum.
Well, at the same time, patients who have recovered from COVID-19 are being advised to engage in mild exercise. 2 medical experts say this helps to prevent blood clots from forming, a condition that is linked to the virus.
The fatal condition was brought closer to home when a 41-year-old migrant worker from China, who was deemed to have recovered from COVID-19, died last week. He was found motionless in his cabin on a cruise ship, where he was temporarily housed after being discharged. The coroner certified the cause of death as a massive blood clot in the lungs following the infection. With emerging data globally, doctors here were told by the Health Ministry last month to look out for cardiovascular symptoms among those infected by the coronavirus.
There is now scientific evidence that the virus can attack the endothelial cells, which are lining the inner lining of blood vessels directly. This caused the blood vessels to be leaky and release a lot of clotting factors that trigger blood clotting. So heart attack and stroke have been reported in these patients that arise from blood clots that blocks the major arteries supplying blood to heart and brain. Blood clots are also found in other parts of the body.
A smaller section of clots that form in the leg may be dislodged and travel through the blood vessels to other parts of the body, sometimes getting lodged in the smaller blood vessels of the lung, preventing blood flow. This leads to shortness of breath. The affected person might experience symptoms like chest pain, heart palpitations, fainting spells, and even coughing out blood. With the constricted blood flow, the lungs will not be able to top up the level of oxygen needed. This in turn causes the heart to go into overdrive, resulting in heart failure. Those who are inactive, the elderly, and also those with underlying medical conditions are at higher risk of this.
There is certain recommendations that doctors are right now considering whether they need to be put on anticoagulant treatment, right, in terms of preventing the potential blood clotting. But this is still an area that is rather contentious because we need to weigh the risk-benefit of administering the use of anticoagulant, which could have side effect of creating unnecessary bleeding in the patient.
But as doctors and scientists continue to learn more about the characteristics of this coronavirus, doctors say light exercises is perhaps the only way to help reduce the risk.
I will rest for the first couple of weeks and thereafter start low, go slow, which means I'll start about 10 to 20% of what I normally do and then ramp up as well as my lungs can tolerate, my body's endurance can tolerate. Again, don't push myself to the maximum because this may be detrimental. Start low, go slow. That's the mantra we should all have.